sure it has players. Hello, everyone. It's Monday, June the 22nd. I want to first of all apologize for us starting late. I've got a full-fledged family medical emergency going on, and that's why we're late today. And I'm not going to get into all the details, but I am going to get into just the continued performance of an individual in the state of West Virginia that is despicable beyond belief. Phil Kabler has worked for the Charleston Gazette for a long time. And without any question, what he did with one of our state employees here at, that works so hard in the general services area, cleaning our facility here at the Capitol. Here's what he did. You be the judge, West Virginia. Here's what he did. He tweets out about a person's mental issues or problems. He basically plays games with them by setting cans in a certain area, and they would come in and move stuff around and everything, of which then he went on to make fun of that person. Then he got on our briefing here and started crying and everything and said, oh, how sorry he really is. And what did I do? I took the highest road in the world, even though I know what kind of bum he is. I took the highest road of all. And I said, it took a big man to stand up and say you're sorry. Well, he's not a big man. He's a nothing man. And I'll go on to tell you why. And then I said we should forgive, and we should always do that. But now, just think about this. Then, from what I know, he was suspended from his job for 2 weeks. He should have been fired. He should have been run off for sure. But anyway, nevertheless, he's suspended for 2 weeks. Then he comes back, and on the very day that he came back, I mentioned a little 7-year-old kid. His name's Landon. He's one of our foster children. He was moving on to another facility. The first question that kid asked me, and I'd love to show you his picture. Absolutely, the first question when I called him on the phone, because they said it'd be so neat if you just call him, because he watches the briefings every day. And really and truly, what he was wanting to say to me was he was wanting to say, Governor, I watch you every day, you're doing a great job, or something to that extent. But I mentioned him because our foster kids have been impacted by this COVID-19 thing in a gigantic way. They've not been able to go to school. There's been so many issues, but here is a 7-year-old, and here is this grown man that the Charleston Gazette employs. And the very day that he comes back from some level of suspension, he basically ridicules a 7-year-old foster kid. I mean, that's all there is to it. And then today he tweets out, Justice isn't there, blah, 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 and everything. And he doesn't have a clue what Justice is doing. Justice is meeting with delegates over to Mansion, and Justice is trying to get here from the standpoint of dealing with an absolute family and medical emergency. Now, I don't need anybody to feel sorry for me, but I tell you the honest truth, and I can't say it any more blunt. Phil Kabler is a lucky man that he doesn't work for me, because he'd find his hind end headed down the road tomorrow, the very second that he absolutely went out and ridiculed our people that work so hard here, and then went out and ridiculed one of our foster children. Absolutely. Are you kidding me? And now, he doesn't ask or anything. He just comes out and says, Justice in there and all this kind of stuff. Listen, I don't have a bone to pick with Phil Kabler. I think the man is poison to the state of West Virginia and has been that forever. And it is a crying, pitiful shame the way he behaves and the way he acts. Now, I've said enough on that, that's for sure. Let me go back to this. We had a bad thing happen today. and or over the weekend rather, we lost another person in West Virginia, a 74-year-old female from Berkeley County. It was our first death in 10 days. Again, it's one too many in 10 days. It's 89 too many in our state. And, I ask, that you'll keep this person in your thoughts and prayers and all their loved ones and everything. I'm sure that she was a beautiful, beautiful lady, and I just hate it. I hate it terrible bad. I'd ask you just this too. From time to time, there are things that come up with any of our families and everything. And again, I'm not going to go into the details of what's going on with mine, but I surely have something that came up on Father's Day, and everybody's running to the fire and everything, and it is a very serious situation. So please keep our family in your thoughts and prayers as well. Now, I want to read this to you. The number of active cases in West Virginia is up over 100 since last Friday. Now we sit at 782 active cases. And we're seeing the results of people traveling out of our state, especially to places like Myrtle Beach, and we see the fact that this disease has not gone away, has it? It's still right here with us. Now, fortunately, in at least some of these cases and everything, the younger folks, especially on a national basis, are becoming more infected, and they can tolerate it. And they surely can tolerate it much easier. But I would continue to just encourage in so much, every way, watch what you're doing. For crying out loud, if you go out of state, try to wear a mask. Try to wear a mask anywhere you go within state, when you go out into a building, especially in our churches. We are not seeing bad numbers, but we're seeing enough numbers that absolutely will cause us to pause and to hesitate in every way on what we're doing. Now, we're starting youth games with spectators and outdoor events with spectators and equestrian stuff with spectators and motorsport with spectators and all that. That can all change tomorrow. That can all absolutely change tomorrow. And what's going to change it? It's not going to be me that's going to change it. It's going to be you. And what I'm saying is we keep pitching numbers that aren't good, we'll change. I've told you over and over and over that this is a very fluid situation, and I am absolutely going to do my job. I'm going to do it every single day, and we're watching the numbers. We don't have anything bad yet, but West Virginia, just absolutely, come on now. We got to keep really getting after it. I've got to tell you this, we lost a firefighter over the weekend. He's one of our first responders. According to the West Virginia State Fire Marshal's Office, 42-year-old firefighter Russell Robertson tragically passed away while responding to a fire in McDowell County. It was a house fire. He was a volunteer fireman from the Yeager Volunteer Fire Department. The fire and incident is currently under investigation by our state fire marshal. Every single one of our firefighters, first responders, and all those, are our heroes. They've been that forever. They come always running to the fire. We're going to absolutely miss them beyond belief, and we know that this man is an absolute hero. The family's having a tough time. And really and truly, we ask so much that you pause and have prayer for this wonderful, wonderful man, a hero that we just lost. It's hard to say something like that and then just move on. This family needs to absolutely know that Russell's not going to be forgotten. But I don't know what else to do but move on. We still encourage our cities and our counties to continue to apply for our CARES money and everything. We will have an announcement by the end of the week that will be a complete wrap-up of everything, from all the money, from the standpoint of where we're going to fall and where everything's going to fall out in the month of June, and the outlook for how we're going to go forward beyond June for next calendar year 2021 that begins July 1st. Today we have sent out $11,072,000 plus to our counties and to our cities. We continue to ask them to apply. We now have 24 applications that we've received so far. We know we have to comply by all the guidelines the federal government gives us, but there are ways that we can follow those guidelines and pump out tens of millions of more dollars, and we have allocated and set those monies aside to be able to do that, of which we'll give you the entire roadmap of everything by the end of this week. On a jail update, I continue to salute our correctional facilities and all the work that they've done. You know, there are now 6 active cases in one prison at Huttonsville. All the other correctional facilities have 0 COVID patients, and the enhanced testing that we did, it just knocked it out of the park. 10,000, I think, inmates and 4,000 employees. You know, again, our people did what they were supposed to do. They ran to the fire. They did incredible work. On the church outbreak update, there are still 3 active church outbreaks in Ohio, Greenbrier, and Boone County total, 3 total, 1 in each county. Ohio County has 18 positives, Greenbrier County has 41 positives, and Boone County has 9. And again, I keep saying the same thing, but I strongly encourage. While you're at church, while you're anywhere in a building outside of your home, wear the mask, stay social distance. Every other pew, absolutely, in a church setting where people are singing and close together, it is an absolute breeding ground for this disease to perpetuate itself, and we've got to absolutely be on our game there. In Raleigh County, at a nursing home there, we now have a person that is a direct care staff member that has been tested positive. The employee worked in the facility the day before and the day after the positive test while wearing a cloth mask. And the county is testing now all residents and all staff today. Our summer feeding program continues, and you'll see the map up on the screen. It's 670 sites. If you have any issue whatsoever where you need food and where you need to go, call 211 and we'll get you to the right spot and everything. And because our goal is to see that no West Virginian goes hungry. So please check that out. And if you got a problem, call 211. The free testing that's going on, where we're trying to test our minorities, and we're trying to also test the most vulnerable. But if you have any level of anxiety, any level of issue that you want to be tested, this week we'll be in Boone, Lincoln, McDowell, Raleigh, and Wyoming counties, and this will be Friday and Saturday, June the 26th and 27th. We will also be in Cabell and Hancock and Mingo counties. It's optional testing, painless, cost you almost nothing, or cost you absolutely nothing, other than a little bit of time. Now, I want to update you just a second on Myrtle Beach, a place where all of us, I don't know one West Virginian that hadn't been to Myrtle Beach hardly. Maybe with the exception of that little foster kid that landed. You know, I go back just a second to that. You think about that little foster kid, you know, from the standpoint of a day that he was having, and if I remember correctly, where he was going to have chocolate brownies and ice cream and some kind of strawberry type drink. That probably would have been one of Landon's best days ever. I mean, you just think about it. What did we do? What did Phil Kabler do? he absolutely just disrespected that kid in every way, and all the great workers at our foster care system and everything. And I'm not wanting to rant about Phil Kabler because he's not worth it, you know. But at the same time, I would bet in many ways Phil Kabler's worst day could have very well been Landon's best day. And so that's a crying shame to me. But back to Myrtle Beach just a second. You know, Myrtle Beach is surely having a big time outbreak. We have multiple individuals that have traveled to Myrtle Beach, and get this now. In Berkeley County, we got 12 individuals. Cabell County, 5. Kanawha County, 3. Preston County, 26. Raleigh County, 2. Taylor County, 1. And there's got to be more. But this is enough. This is enough right here to cause us a big time problem in West Virginia. So again, I cannot tell you any more profound than just say this. If you've gone to Myrtle Beach, we want you tested. And when you get back, take advantage of the free testing or something. Get yourself tested, because we need the information, and in order to be able to protect you, we've got to have information. And Myrtle Beach is an absolute hot spot, and you know, if I were you, I would consider going somewhere else. But at the same time, if you end up at Myrtle Beach, you end up back here, please get tested. I think the very last thing that I've got is a situation where we had a state of emergency declared for Greenbrier and Monroe counties after a significant amount of rainfall that fell, especially, you know, where we had significant flooding in Alderson. No one has died, but several structures were damaged. I want to thank everybody from the emergency management people to the DOH to our National Guard for quickly responding to this emergency, and for the residents affected in the area. The West Virginia Guard will start debris pickup in the Alderson area on Wednesday morning, and all debris needs to be at curbside for pickup. Look, I've watched a whole lot of that, and I've seen the tragedy of that like I can't imagine. But again, I don't know what to do other than just try to let you know that some way, somehow, you know, we're all going to get through this, and we're all going to be with you trying to help you get through it. But I've seen people put their memories and their treasures of their life, you know, in a pile on the edge of the road, and an inloader come around and pick it up and just dump it in a truck. And it's sad. It's sad. But you still got all those memories, and all those memories are right here in your head and everything. They'll never go anywhere. And so with the strength of God above and everything, all the people that are working with you and everything will get you through it. So that's all I've got for today. Thank y'all.
All right, thank you, Governor. Let's first go to Dr. Clay Marsh, our coronavirus czar.
Well, good afternoon. I want to also ask that our good people of West Virginia really pay attention to what the governor has instructed. We know that nationally, 12 states over the weekend saw their all-time high numbers of coronavirus cases. 17 states are seeing increases in hospital activity. One state's activated their emergency management plan. In Florida, in Georgia, in Texas, they're starting to see shortages of ICU beds in certain counties. So we know that the COVID virus has not gone anywhere. In West Virginia, our RT values, or our reproductive values, are going up some. They're over 1. And while that should not cause us to panic, nor does it, it should be a good reminder to us that we are not immune from the spread of COVID-19, just like the 12 states that are seeing increase in their activity. And so as we look at states like Georgia that opened up early, that seemed to be protected for a while, well, that's no longer the case. And so what we want to make sure of is that we are acting in a way where we are protecting ourselves and our communities, as we have done so amazingly so far. And so I know the governor has said this, and I will reinforce it, that this is not a means to try to impact anybody's personal liberties, but in fact, our ask that you consider wearing a face covering or a mask and maintain social distance, physical distance of 6 feet or more. Wash your hands, avoid your eyes, your nose, or your mouth when you're in public, when you're around other people, is really done so that we can support our ability to continue to open our state safely, to protect the people in our state, the people that we love in our communities. And we know that as we look to open our state even more, that the fewer the number of cases, the governor mentioned the problems that we're seeing in South Carolina, for instance, in the Myrtle Beach area, that we know that that will impair our ability to continue to open our state in the way that we want. And I misspoke on Friday, and I want to correct this, that when we look at the number of cases in the US, and remember, the United States represents 4.25% of our world's population, but we have a quarter of the COVID cases. And I said a half, but we have a quarter of the COVID deaths. So we see a very much increase in COVID activity and deaths in the US, say, versus our population. But West Virginia, you're doing so well. Please keep it up. The world needs a beacon. The country needs a beacon, and you are being that beacon for so many. But don't let your guard down. Don't get complacent. Please protect yourself and protect our great state, as our state had a birthday on Saturday. And if we do that, then we will flourish during this very, very, very challenging time. So thank you.
All right, thank you, Dr. Marsh. Next, we'll go to Secretary Bill Crouch with the West Virginia DHHR.
Good afternoon, everyone. I want to provide a very brief summary of our facility testing in response to a question on Friday that I misheard. As you probably know, the state of West Virginia has 2 psychiatric facilities and 4 long-term care facilities in the state that we operate. Regarding the 2 state-owned psychiatric hospitals, in May, we had an employee who tested positive for COVID at William R. Sharp Junior Hospital in Weston, West Virginia. As a result, we tested all of the employees and all of the patients on that wing that employee worked on. We found no additional cases at that time. However, several weeks later, we did have another positive case. So as a result of that, on June 1st and June 2nd, we tested the entire population, the entire patients, all patients at Sharp and all employees at Sharp Hospital, and found no additional cases. Both of the cases that we had there were acquired outside of the facility and were attributed to community exposure. The other psychiatric hospital is Mildred Mitchell Bateman Hospital, Psychiatric Hospital in Huntington, West Virginia. We have not tested the entire population there, but there are ongoing conversations about that. We have had no positive tests by employees at this point, and no positive tests by any patients, where there have been a few people who have been tested. So with regard to the 4 long-term care facilities, as everyone knows, on April 17th, the governor entered into an executive order requiring all nursing homes in the state of West Virginia to be tested, the first in the country to do that. Our 4 long-term care facilities were tested as a part of that executive order, and we found no positive tests. Those tests were all completed by April 24th. Again, no positive cases. So as a result of the governor's executive order and the staff of DHHR and of course the National Guard, who we always appreciate assisting us with these things, we've done a good job at keeping the virus out of our state facilities. But I really want to thank the employees. It's the employees, the state employees of these facilities, who are practicing good infection control procedures, and they have worked very hard and tirelessly to keep themselves safe and our patients safe. So I thank them very much. Thank you.
Thank you, Secretary. Next, we'll go to Major General Hoyer with the West Virginia National Guard.
Good Good afternoon. As Governor Justice pointed out, states of emergency in Fayette, Greenbrier, and Monroe County, National Guard providing support to local emergency management and working in conjunction with Division of Highways as well as Red Cross and VOAD. We completed the mission in Fayette County and are resetting our forces. And as the governor pointed out, at his direction, we'll be in Alderson to work the Greenbrier, Monroe County issues on Wednesday. We continue to support our public health partners, both at the state and local level, with testing as well as planning for upcoming testing. Are working also subject matter expert efforts with particularly focusing on churches at the governor's direction for those churches that will have services in person, helping to identify best ways to mitigate potential spread of the virus. Also working on sanitization missions going forward as well. Finally, I want to, on behalf of all the men and women of the West Virginia National Guard, our families, let the Roberson family in McDowell County know that we have them in our thoughts and prayers, and we appreciate the heroic actions on his part and deeply regret the loss of life. Thank you.
All right, thank you, General Hoyer. Dr. Kathy Slimp, our state health officer, is also joining us today and is available for questions. Once again, we're holding today's briefing with media members joining us virtually to practice good social distancing. The first questioner today is Mark Curtis with Nexstar Media.
Good afternoon, Governor and cabinet members. I'm curious about with this spike in all these other states, of course, people from this state going to Myrtle Beach and coming back, but the July 4th holiday weekend is really just 10 days away. Are there going to be any reimposed restrictions on who can stay at campgrounds and cabins in West Virginia? The use of Hatfield and McCoy's trails. I mean, are we going to be wide open for tourism on the 4th of July weekend? Or are we going to try and curtail some of the activity due to the spikes that we're seeing?
Mark, the best way that I can answer that from my standpoint is every day we watch. Today is June the 22nd, and we've got some time between now and July the 4th, and I've said it over and over and over. There is no playbook. It is an absolute fluid situation, and we've got to react, and we've got to be able to pivot and move quickly when we pivot. We're watching. We're watching like crazy right now. We're very, very hopeful that the 4th of July can be celebrated in West Virginia in a really good way. But we're just watching, Mark. That's all I know. And we're seeing numbers that have spiked from the standpoint of active cases in the Myrtle Beach area. You know, I've said, you know, is something that's really concerning. But you make good points. You know, the 4th of July weekend, there'll be visitors here from lots of different places and everything. There'll be West Virginians in lots of different places. And so let's just wait and watch the numbers, watch the amount of hospitalizations, watch as best we can, and then we'll adjust if we need to do so.
All right, thank you, Mark. Next, we'll go to Annie Moore with WVVA. Looks like we're having trouble connecting with Annie. We'll come back. How about David Beard with the Dominion Post?
Hi, David Beard. Dr. Marsh reminded us again, don't get complacent. I'll speak anecdotally. When I go out to shopping to grocery stores, box stores, I see probably less than half the people wearing masks. Do you think this is reflects complacence, or what's your take on that?
Well, David, I've said this over and over and over, but I don't really, absolutely nobody wants to get in this situation where you make the wearing of masks mandatory. If you get to a situation where you have to make the wearing of masks mandatory, then I'll do it. But at the same time, when we do it, we're going to divide people. Now, if you'll step back and look at the miracle that has happened in West Virginia, we've done it by being together. We've done it by being all of us pulling the rope together. I know that it seems like, well, you don't really want to hear that, and it keeps going and going and going. and everything. If these numbers start to change and change significantly, we'll do it. We'll absolutely do that. We will make the wearing of masks mandatory. I don't know how it can be more blunt than what Dr. Marsh has told us over and over and over. And we're watching the hospital numbers. We're watching everything from the standpoint of what Dr. Marsh is doing to everything from Dr. Slimp and on and on and on. Now, in that, you have got, again, West Virginia, to listen to me, Dr. Marsh, our greatest medical expert, myself, Dr. Slimp, all of us are telling you, if you go out in public and you go into a building, wear a mask. Wear a mask. Lots and lots and lots of people are complying, and I have had report after report after report of people that are doing incredible work at churches and different places. And I see the obvious. I see situations just that happened in the first church there in Greenbrier County. I see a situation where people didn't do a very good job. So the long and the short of it is, we're going to try to continue the course and everything and telling people, but at some point in time, if we have to, we'll move to mandatory masks. Think about this just for a second. We have now tested 151,113 West Virginians, and we have a cumulative positive rate of 1.69, and we have a daily positive rate today of 1.66. If you look at those numbers, we have almost tested 1/10 of our total population in this state. Now, what I want to do is continue to test more and more and more and more and more, because the more information you have, the better job I'll do. With all that being said, our numbers, our positive numbers on a daily basis or cumulative basis are great. They're great. We really just have to continue to test. We have to continue to watch the numbers. We have to continue to try to tell you, West Virginians, continue to be the miracle. Be the miracle. Be the beacon that Dr. Marsh was telling us about. Be the miracle. You can do it. You can really do it, West Virginia.
All right, thank you, David. Next, we'll go to John Mark Shaver with WV News.
Hello, everyone. With the spike in cases over the weekend and the 4th of July coming up, would you advise people to maybe not travel for the time being out of state? Or would that be all right?
I'll make it real simple. I would try every way in the world, to tell our people that if you don't have to travel out of state, why do it? Why in the world do it? I mean, really and truly today, there's so many things you can enjoy in the state of West Virginia. If you got a vacation and go to one of our state parks, do all kinds there are so many different things you can do in West Virginia. It is just absolutely the place to be. Now, if it's the place to be where others want to come here, go enjoy West Virginia, But if you have to go out of state, you just got to protect yourself and be super smart.
All right, thank you. Next, we'll go to Kenny Bass with WCHS and Fox 11.
Hi, this is Kenny Bass with Channel 8 and Fox 11 in Charleston. Governor Justice, when you intimate that more restrictive orders could be coming from the state if the numbers go south, I'm wondering about your thoughts about the enforcement measures that the state would do or has done in the past several weeks. While it's an order, it almost comes across as a very strong suggestion, because as you've said many times, it's very difficult to enforce these types of rulings on a statewide effort, especially something like wearing masks, which would involve hundreds of thousands of people. So how effective do you think the orders are versus just strongly suggesting what people should be doing in the wake of the virus?
Kenny, it's if you look at what we did as West Virginians when we ordered the shutting down of restaurants and bars and schools and all the different things that we did, the state basketball tournament, when we have ordered things, there's been a lot of good come out of that. I think the most significant thing of all that has enabled us to produce these numbers like we produced is the people listened. Now, there's no question that, there's all kinds of situations to where maybe they're not listening to the level that they should, but for the most part, the people really listened. Now, it's tough. If we ordered people to wear masks and everything, it's tough for the state police to run in and haul somebody off to jail because they don't have a mask. And I don't want us to get into that kind of, martial law society. I mean, that's the very last thing that we need to be doing in West Virginia. But, I think today, if I'm correct in this and everything, and I'm not exactly sure, but I think we have 4 individuals in West Virginia that are on ventilators today, and we have 66 that are hospitalized in the state of West Virginia today. Now, just imagine, we don't want 4 on ventilators, and we don't want 66 people hospitalized. We got that. But for crying out loud, that compared to others is next to nothing. And so again, 89 deaths is 89 too many, but compared to others, it's next to nothing. And the last thing I think we want to do is start shutting down our economies and shutting down West Virginia again and everything until we got numbers that warrant it.
All right, thank you, Kenny. Next, we'll go to Steve Adams with Ogden Newspapers.
Yes, Steve Adams of Ogden Newspapers here. I was just kind of crunching some numbers this morning. The New York Times has a really good coronavirus tracker, and they track the rate of change over a 14-day period compared to the previous 14 days, which is the incubation period of a typical coronavirus. And right now, the U.S. is sitting at about 20% increase in coronavirus cases versus a 43% decrease in deaths. And based on looking at West Virginia's numbers, and one of the medical professionals can try to correct me if I'm wrong on this, but it looks like West Virginia's 14-day rate increased by 15.7% over the previous 14 days, but testing has increased by 50% during that same time period. And our deaths are down 58%. How much, and this could be for the governor or one of the health officials, but I mean, how much of a lot of what we're seeing right now is being driven by the fact that we're doing free COVID testing every weekend in the state, and local health departments are also doing their own testing all over the place? How much of this is really based on that we are testing significantly more than our surrounding states? Thank you.
Well, let me start, and then maybe somebody else in the medical community or General Hoyer could weigh in. But now just think about this. The amount of percentage of West Virginians that are tested, is 8.499%. Our nation is at 8.0. Every one of the other states that are around us are at 5 and 5.4 and 6, and we're phenomenally way past them in the amount of people that are tested. Now, I know that really and truly our president was kind of saying in jest, something at one of his rallies in regard to the amount of testing, that maybe what we should do as a nation is slow down. Because the simple fact is, the more you test, the more positives you're going to get. Well, I don't believe that here. I think that and I don't really believe that our president believed it either, but I really believe here in West Virginia that we need to test as much as we possibly can. Remember, we're the most vulnerable of all the states. We're the oldest, and we have the most chronic illnesses, and we sit right at a sweet spot, right, within a rock's throw of 2/3 of the population of the country. Now, the numbers are unbelievable. The more we test, the more we'll learn. Sure, the amount of positives will go up by the more we test. So what? The more we test, the more we learn. And so I welcome the fact that we're continuing to test. You know, naturally, if we slowed down and we didn't do the free testing and whatever like that, your numbers may look a little better, but these numbers look great anyway. But anyway, I'll defer to Clay if you'd like to talk, or Dr. Slimp, or anybody.
Now, maybe I could start, if that's okay, Kathy, and then I'll pass the baton. So I think that is, the governor is exactly correct, that, you know, not only do we find more people that are positive as we test, but as we've talked about, we really want to find the people who can spread the most readily, the super spreaders. So every time we find somebody who is positive for COVID, it gives us an opportunity to try to reduce that rate of spread if that person turns out to have a lot of virus and we happen to catch them at the right time before they can spread the virus readily. One thing that I didn't mention in my comments, which is important, and the governor mentioned it, we were also very closely tracking hospital admissions from COVID, ICU admissions, ICU beds, and we are really not seeing a rise in those. As was pointed out, our deaths have been very stable. In fact, we haven't seen a COVID death up until just in the last day or so. So that's a really good sign. And although our reproductive number is up, that can be an early sign for us to follow. And that's the reason why we're doing so much testing. So I think that we are trying at least to stay ahead of where we see a major problem. And we're trying to continue to very aggressively identify those areas where we see more activity and make sure that we're doing the case investigation, the contact tracings, and making sure that as we find people that we are appropriately isolating them and trying to prevent them from being able to then increase that rate of spread as we've talked about, so we avoid the surge. So Kathy, other comments?
Sure. The community-based testing is really great for giving us a kind of a snapshot of what's happening in a community. And so it really helps us kind of go in and see what's happening, testing anybody who would like to have that testing done. What we've defined is that we find cases in situations where we know we have high spread going on in that community, and it gives us an early sense of that. But it's actually not where we are finding the bulk of the new cases that you're seeing coming in. Those are being picked up because people are symptomatic or because they're having other testing done. And so what we're seeing actually is true. It's not just a reflection of the increased testing. The more we test, the more we find. And that's why we encourage our providers to test anyone with symptoms. We encourage anyone who has symptoms they think they might have this to definitely go and get tested. But what we're seeing is actually an increase in actual cases of disease as well. So, for instance, we've had a 28% increase in active cases in the last 2 weeks. And that's been a shift from what we've seen before. It's starting to change that curve shape. Our R values had been trending down, and the last 2 weeks are starting to trend up. They're just around 1, a little bit over right now, but it's starting to change direction. And I think we are seeing community outbreaks, as we've seen through churches and through family gatherings and other kinds of things. And so I think all of these say to us that the disease is really beginning to pick up a little bit. And we want to make sure that that does not continue and kind of go steeply up. And so that's really what it's all about in terms of all of us recognizing this disease is with us still. It is here. We can travel out of state and bring it back. We can get it locally. It's all about what we can do together to really prevent spread and to protect ourselves and those we love. So I do think that it's not just the testing. In terms of the community-based testing, testing is critical. We've got to all be testing, community-based testing, provider testing. If you think you might have this disease, go get a test through your healthcare provider or other setting. We will find more that way. But it truly is changing. It's not just a reflection of the testing.
All right, thank you, Steve. Next, we'll go to Dave Mistich with West Virginia Public Broadcasting.
Hi, Governor. Dave Mistich, Public Broadcasting. My question is about a potential special session. Before, the election, you said that you had anticipated having to call the legislature back. I've spoken to some legislative leaders, particularly those that sit on some finance committees, and none of them are anticipating this to happen. As a matter of fact, they said that they don't expect that to be something that happens. Can you tell me why that is, and also how the mechanisms for the state budget that allow us to keep going up to the end of the month?
Okay, I think I can do that. First of all, I want to tell you this. You know that we've formed basically a committee, and that committee, we're going to be meeting with them later on this week, and we're going to be updating them on all kinds of different things that our revenue people have been bringing to me day after day after day, and we'll do that. You know, it depends on, you know, from the standpoint of what's going on with my family and everything that I've got to tend to, but I think we'll be able to do that probably on Wednesday, and so, you know, as we meet and everything, we'll go through all the you know, nitty gritty of all the numbers, but from the standpoint of getting into, you know, how the numbers are working and everything, all I would say to you is just this, that I said all along that what I knew about where West Virginia was and what West Virginia was doing from a financial standpoint, I've said all along that West Virginia will be just fine. We didn't need to rush and lay people off, or we didn't need to rush and say we're going to have to cut this and do this and everything else under the sun. But and in doing so, I'll be able to unveil to you, you know, right toward the end of the week, but at the end of the week, you know, I'll be able to unveil to you all the different numbers and absolutely show you how we have been able to reach the end of the year. I am very pleased that we continue. We started down the path of just this. We were worried early on that we felt like we could make it till sometime in May. And then that moved to like June the 11th or 10th. And now we are absolutely rock solid that we can make it cash-wise to the end of the year without any trouble. And, you know, we're going to have a real bump in July, you know, from the income tax standpoint, and that should get us off and going in next year. But we still got a long ways to go in this. There's a whole lot of different moving parts and everything, and we'll get into all of it on later on in the week.
All right, thank you, Dave. Next, we'll go to Paul Mullen with WCBC. Looks like some trouble connecting to Paul. Anthony Izaguirre with the AP.
Governor, what would be the bar on readjusting the virus safety rules now that we're seeing spikes?
Did Anthony say what would be the bar that would be the parameter of what we would use, you know, to back things off as far as different things that we're doing? If, Anthony, that's your question, you know, the bar becomes lots of different things. The bar becomes what our health experts are saying first and foremost, because every one of them knows that they can speak so freely around me, it's unbelievable, because that's what I want. I want knowledge. And if they're concerned, they speak up. From the standpoint, the bar also becomes all the knowledge that we're obtaining from the federal government, all the knowledge that we're obtaining from our hospitals, all the stuff that is going on from, you know, from the standpoint of hospital capacities or issues, you know, with the sick, how many people we've got on ventilators, how many people we've got in the hospitals, what are the number of positive cases in the percentage, how does a cumulative number work? There's a lot of real science to this, and there's a lot of gut feeling. You know, from the standpoint of our experts start, you know, showing some waffling and concern, then I'm going to react, because I really believe that that's what we've already done. You see, when there was concern about our nursing homes, we reacted and we closed visitation, boom. And then we jumped and we were the first in the nation to test all of our nursing homes. I could go through how West Virginia's been first in the nation over and over, but at the same time, the bottom line is just this. Somebody's got to be the leader of the band, and somebody's got to make the calls, and those calls are really tough to make, But I am telling you, when it gets iffy and people get concerned, I'm going to act right then. I'm not going to wait. I'm going to react right then. Right now, we're still good, but we still got a long ways to go. And there's no question this virus is still here, and all of us are real concerned, and all of us are trying to do one thing, and that is bridge ourselves to a vaccine, bridge ourselves to a drug. How long is it going to take? Is it going to happen in September? Is it going to happen in January? How long is it going to take? And how are we going to manage the risk? We're not going to get rid of it until we're able to get that vaccine. How are we going to manage the risk? That's what we're trying to do.
All right, thank you, Anthony. Paul Mullen, looks like you're connected now. Go ahead.
Thank you, and good afternoon, Governor. I hope things go well with your family situation. My question deals with a follow-up to Mark Curtis's question. It's about the tourism of West Virginia. If you have seen any increase in tourism, if you have any real-time data to track such tourism, and what kind of effect that's going to have on the state budget, because any kind of income is going to be a good thing.
First of all, we do have a lot of real-time data, and for what I know, we have seen an incredible upsurge of West Virginians with our state parks. You know, when we offered West Virginians to go to our state parks for a 30% discount, we had a great big bump in regard to that and everything. So you know, from the standpoint of our tourism people watching, you know, upticks as far as tourism, we are upticking, you know, but from the standpoint of everything across our state, I mean, you know, Paul, one of the first things that happens was people said, well, the Hatfields and McCoy trails, that is a place where we could get in a lot of trouble, and we should not open that back up. And then there was a lot of discussion and everything. And then all of us kind of agreed, okay, we're good to go. Well, we've had a few blips on the screen there and everything. And there's been lots and lots and lots of people there, you know, from out of state. I'm sure that they're complying as best they possibly can. I'm sure the people that are handling all the cabins and all the facilities are doing great work, because to be perfectly honest, that moved from something that everybody was real concerned about into a situation to where I think we're good there. And so again, we just got to keep watching it.
All right, thank you, Paul. We have time for one more. We'll go to Taylor Stuck with the Herald-Dispatch.
Hi, everyone. It's Taylor with the Herald-Dispatch. Governor, last week or the week before last, when talking about Workforce West Virginia and unemployment, you said, you know, people are making more money than they do working. They make more on unemployment. So I was wondering if you think that is an issue in West Virginia that should be addressed, that there are people who are willing to possibly commit fraud for relatively little money.
Well, Taylor, and you got to forgive my ears. I'm doing the best I can to understand. But, you know, I think from the standpoint of, you know, the federal government's $600 basically bonus program, that was going out to everybody, you know, that was somewhat of a windfall, to be perfectly honest, to a lot of people, but that's great. You know, that was great as far as I'm concerned in West Virginia, you know, and, it's really, if we just look at it, it's such a little amount of money. You know, it's not all the money in the world. The federal government came up with that program, and I was tickled to death, you know, that our working people got those dollars. Now, I think that's going to run out. I think there could very well be I believe wholeheartedly there's going to be another stimulus package. I think it's going to come sometime in mid-July, you know, probably prior to the running out of the $600 situation. I think that it could very well be a bonus to encourage people to go back to work, which will give another bump to our working class people and all that. And but that $600 a week was good stuff. Now, Taylor, the other part of your question, I didn't get it. Could you tell me the last part of your question again, please?
Yeah, I just was wondering if you think that that's an issue that, the state should maybe address or try to address, that there are people in West Virginia that $600 was really a lot to really in their pockets and could really help them.
Well, Taylor, there's no question whatsoever, that the $600 to a lot of families in West Virginia or to a lot of individuals is all the money in the world. But what I was saying too was from the federal government standpoint, it wasn't all the money on the planet, and really and truly I was just tickled to death that they gave it to our working class people, because they were in real trouble because everything in the world was shut down and the government shut it down. We shut it down. And so with all that being said, again, you asked something else, in regard, you're asking, is there something that the state will do, I think, that will be able to backfill that as we go forward? And we're looking at things right now, and we'll unveil some of those things that will help in regard to small businesses, and we're going to try to unveil that, before the end of the week and or toward the end of the week. And but in addition to that, Taylor, I think you're going to see, like I said, I think you're going to see another step of the stimulus packages and everything that will help those individuals as well.
All right, thank you, Taylor. Governor, I'll turn it back to you.
Well, I only have two things. One is a pronunciation mistake on my end. Russell, it's Roberson, and I pronounced it Robertson. Please forgive me, to that family and everything. So, and the only other thing that I would say is just this, I want everybody to hear me on this, but I especially want one beautiful little 7-year-old. I wish to goodness I could show you his picture, and just what a beautiful little kid this little Landon is. And I hope and pray so much that, the first question that he asked me was, Governor Justice, can you help me get a family that I can live with? And now, listen, and I want to talk directly to Landon. Landon, we're going to work it until we get it done. And I want you to know just this, of what I've already said today. There are people in this world that say things that they shouldn't say. But I want you to know, Landon, that you're just exactly what I already told you are. You're a superstar. And absolutely, you should be so proud of yourself, and I'm proud of you, and we're going to work really, really hard in this world to fulfill your dream. Landon, you told me you wanted to be a doctor someday. And gosh knows, if you want to be a doctor some way, somehow, we're going to pull that off. That's all I've got. God bless everybody.